Dr. Omari J. I'm an obstetrician and gynecologist at Hurley Medical Center. I'm happy to be speaking on gynecologic health, midlife to menopause, as a part of the Hurley Healthy Living series. Disclosure, I have no relevant financial or non-financial relationships in the products or services described, reviewed, evaluated, or compared in this presentation. One of the most important topics I want to present first is the Well Woman visit, what encompasses that visit, what does it entail, and what questions that each woman should ask at this visit. Preventative care and screening, contraception counseling, and family planning, menopause, and hormone replacement therapy. So the first subject I would like to address is the Well Woman visit. The American College of Obstetricians and Gynecologists states that the Well Woman visit provides an excellent opportunity for the patients to maintain a healthy lifestyle and to minimize health risk. This is an important topic because this visit includes screening, evaluation, and counseling, and immunizations based on age and risk factors. More than 50% of preventive care visits for women were to their obstetrician and gynecologist. So even though that we're a specialty physician group, we do provide a lot of primary care and preventive care for women in the community. A particular sensitive topic when it regards to the Well Woman visit is the use of the breast and pelvic examination. Over the last 10 years, the recommendations have evolved on the importance of this aspect of the Well Woman visit. Particularly in 2014, the American College of Physicians recommends against performing screening pelvic examination in asymptomatic, non-pregnant adult women. Also, the American College of Obstetricians and Gynecologists recommends breast and pelvic examination only be performed when the medical history or symptoms indicates. So the old adage that if coming to the obstetrician requires a breast exam or pelvic examination is not indicated anymore unless you are experiencing significant symptoms or your medical history indicates that requires the need to further investigate with a breast examination or a pelvic examination. Another important part overall gynecologic health from the midlife to menopause is preventive care and screening. This involves general health screening, sexually transmitted infection counseling and screening, cervical cancer screening, breast cancer screening, other cancer screening, and osteoporosis screening. Like I said before, obstetricians and gynecologists have a unique opportunity to address non-reproductive health at the Well Woman visit. This can include depression screening, anxiety screening, blood pressure checks, diabetes screening, and intimate partner violence screening. So many other areas that are very important to the overall well-being of a woman that is not just specific to gynecologic health. Cervical cancer screening. This is very, very important screening because it's very much a preventable disease. The incidence of cervical cancer in the United States has decreased more than 50% over the past 30 years due to widespread screening. Most cases of cervical cancer could occur in women who have never been screened or were not screened adequately. Per the American Society of Colposcopy and Cervical Pathology, which is the ASCCP, low-risk women should begin cervical cancer screening at the age of 21. Between the ages of 21 to 29, cervical cytology, which is the pap smear that most women know it by, should occur every 3 years in low-risk women. From the age of 30 to 65, cervical cytology should be done every 3 years or cervical cytology with HPV every 5 years. We know that there are also preventive measures that our women in the community can do to also reduce the risk of cervical cancer outside of just routine screening with their obstetrician and gynecologist or primary care physician. Transmission can be reduced by limiting sexual partners, using barrier contraception, and reducing smoking. But again, this is a very preventable disease, and having routine screening can have lasting impact. Breast cancer screening. This is a very important screen because breast cancer is the second leading cause of death among women in the United States. Annual mammography should be beginning at the age of 40 annually in average risk women. But there is a subset population of women who are at a higher risk. And this has been very popular in the media, given cases of actresses known as Angelina Jolie and other celebrities who have stated that they had risk-reducing surgeries to prevent breast cancer down the road. And this is called hereditary breast and ovarian cancer syndrome. Most commonly in the community, we know this as BRCA or BRCA gene mutation. This is an inherited cancer susceptibility syndrome characterized by multiple family members with breast cancer, ovarian cancer, or both. In women who are deemed to be at high risk, meaning that they have first-degree relatives, or if they have the diagnosis of breast cancer themselves, should consider genetic counseling and genetic testing. And based on the diagnosis, there can be a discussion between your physician, your genetic counselor, with regards to risk-reducing surgery, which could be a risk-reducing mastectomy or removal of breast tissue, or risk-reducing removal of your fallopian tubes and ovaries. The next subject is contraceptive counseling. Contraceptive methods allow women to actively prevent unintended pregnancy and control the timing of a desired pregnancy. The method should be based on shared decision-making, taking into account the patient's desires and medical history. There are multiple options available to women. The decision should be your own and with your family and your partner. There are many hormonal and non-hormonal options. There are many long-term options, which we call long-acting reversible contraception, or LARCs, which can also give you reassurance of decreasing the rates of unintended pregnancy. But ultimately, like I said before, it's a shared decision between you, your family, your partner, and your primary care provider. Menopause. This is defined by the absence of the menstrual cycle for 1 year. Occurs between the ages of 45 and 55, with the average age being 51. This is due to the decrease in ovarian function characterized by the hormones estrogen and progesterone. The clinical presentation of menopause, as most women know, is vasomotor symptoms, which is highlighted by hot flashes and night sweats, and vulvovaginal symptoms or vaginal dryness. These symptoms can range from 6 months to 2 years or last as long as 10 years. So this can cause a significant impact on a woman's quality of life, and there are options available to you. The standard treatment for menopause symptoms is hormone replacement therapy. As stated before, the cause of menopause is decline in ovarian function or the decrease in amount of estrogen and progesterone. So replacing those hormones will resolve those issues and improve the quality of life. The treatment should be provided for the least amount of time and the lowest amount of dose. And particularly, there should be a detailed discussion with your obstetrician and gynecologist or primary care physician regarding your eligibility for hormone replacement therapy. Because historically, we have known in the past that given in the wrong patient population, there can be significant complications and morbidity. Particularly, this treatment plan is contraindicated in women with a history of breast cancer, coronary artery disease, blood clots, stroke, or active liver disease. For these patients, however, we have non-hormonal options that are available for them to treat these symptoms, which can, again, cause significant morbidity due to the hot flashes and vaginal dryness. So there are options for women who have pre-existing conditions and risk factors for hormone replacement therapy. As we approach past menopause into the next stage of a woman's life, which is postmenopause, another significant condition which can cause morbidity to women is osteoporosis. This is significant because more than 50% of women will experience an osteoporosis-related fracture in their lifetime. This is due to, again, the decrease in hormones, estrogen and progesterone, which leads to decrease in bone mineral density. Screening for women should begin at the age of 65 with a screening test, again, that measures bone mass density. Again, this is a very significant disease that can cause a lot of morbidity, as I stated before, which includes many fractures. The goal of treatment is to prevent, and that's why you should get regular screening in low-risk women at the age of 65. And women who are deemed high risk based on risk calculators can potentially require screening before the age of 65. Another significant condition that affects the quality of life and the morbidity of women is pelvic organ prolapse and urinary incontinence. This is a disorder that impacts the quality of life of more than 50% of women during their lifetime, particularly women who are postpartum. Screening should be offered for women of all ages and women in the postpartum period. Pelvic organ prolapse is due to the decrease in pelvic floor support. And again, this is age-related and also can be impacted by lifestyle changes and childbirth. Ultimately, the goal of treatment is to, again, improve quality of life. The clinical presentation for pelvic organ prolapse is something that most women can relate to. Usually they feel pelvic floor pressure or bulge. This is commonly associated with urinary incontinence or the loss of urine. Most commonly, women will endorse the symptoms of unintended loss of urine with exercise, cough, sneeze, or holding any kind of pelvic pressure. There are many options to treat this, whether it be pelvic organ prolapse or urinary incontinence. And again, ultimately the goal is a shared decision, with options being medical, which can include, like I stated before, lifestyle modifications, conservative medical management with a pelvic floor support with a device called a pessary, which can be placed in the outpatient setting, or surgical intervention to strengthen the pelvic floor support and to improve quality of life. There are a lot of preventive care measures and screening tools at our disposal to improve the quality of life and to decrease the morbidity and mortality of women. Reach out to your obstetrician and gynecologist, your primary care physician, to answer all your questions and concerns.